Hello, this is Dr.Vivek consultant pulmonologist at SWASA Hospital, Narayanaguda, Hyderabad. In this particular video, we will be discussing about RTPCR report. RTPCR for COVID. Is this a 100% test that it will give a result for sure? No. If you get a test, there is something called as sensitivity and specificity. Sensitivity is the ability to pick up the positive result. In this particular RTPCR, the sensitivity is only 60 to 70%. That means if I get RTPCR test, if I am COVID patient and I get RTPCR 10 times today, in that probably 6 to 7 times I may test positive, 3 to 4 times I may test negative. That means the chance of picking up the virus is only 60 to 70%. That means 30 to 40% of the times, even though you are a COVID patient, you can have a negative RTPCR report. And this is very, very important to keep in mind because many patients are having confusion in this point. Positive, there is no confusion. Definitely it is positive because specificity of this test is 100%. That means if you are positive, definitely it is positive. However, negative report is creating the confusion. This video is made to clear that. Doctors know it, but many people also need to know because there is a lot of confusion and also a lot of problems that are created in the hospital saying, my test is negative even though you have treated for COVID. No. A doctor knows whether you have COVID or not depending on the symptoms. And previously, in the previous wave, that COVID was affecting your lungs very badly. But this particular Omicron does not affect your lungs so much. So there's no point of getting a CT scan here. Don't get CT scan unnecessarily unless prescribed by your doctor, a pulmonologist. Get a CT scan only if it is prescribed. In this particular wave, we are not seeing so many cases requiring CTs. However, we are seeing cases who are symptomatic but RT-PCR is negative. Does it mean they don't have COVID? No, they still have it. They would have been a history of travel or contact with a COVID patient or a family member having COVID. So you should understand that even though the report is negative, you are supposed to isolate yourself and take treatment. It can be through online consultation. So one clear point here is RT-PCR can be negative in a COVID patient. If it is negative and you have symptoms, consider it as you have COVID and isolate yourself and take treatment so that you will be protecting yourself as well as others from getting this because this is highly contagious. It is spreading at a very, very rapid rate, more than the Delta variant that we have seen last year. So I urge you all to understand this point. RT-PCR is not the final test. It can be negative even though you have COVID. So listen to your doctor, listen to the experts, and if you have a history of contact with a person or your family members have COVID and you have symptoms, then definitely you'll have to go for the treatment and isolation. And one more thing, like the last wave where we saw a loss of smell and loss of taste as the predominant symptoms, Omicron does not cause that. It won't cause loss of smell or loss of taste. So that is not a predominant symptom here. Here the predominant symptoms are different. It's like runny nose, sneezing, nose blocks, sore throats, fever, weakness, headaches. These are the common symptoms that Omicron causes, but cough and breathing difficulty are rare symptoms that it causes. So keep in mind, even though you don't lose smell or taste, but you have other symptoms, it can be COVID. So this video is made for awareness. So I would like you to spread the awareness, but not virus. Thank you.